So the door to unload trial examines a fascinating pathophysiologic concept, and I think it's important to point out that this is not a trial that's going to clinically change anything at this point. This is really a pilot trial, but it examines the concept of what I have called in the past a left ventricular holiday, where you take a patient who has a struggling left ventricle, in this case a ventricle that's had an ST elevation myocardial infarction, and completely unload it with left ventricular assist device, in this trial the Impella. And the concept here is fascinating in that if you completely unload the left ventricle, you change the gradient from the epicardium to the endocardium, of course, because left ventricular diastolic pressure is completely decreased to very close to zero. And you change the microcirculation in the myocardium that, in this case, has been infarcted. So the question that the trial wants to ask is, well, if you unload a ventricle in patients that have ST elevation MI, does it make a difference in terms of, one, outcomes, number two, left ventricular myocardial infarction size? And so it's a randomized trial, not a large number of patients, but nonetheless randomized to left ventricular unloading for 30 minutes and then a PCI to open the vessel versus immediate PCI. Right? Door to balloon time has always been the concept that we've thought of for a long time, and now suddenly people are saying, hang on, maybe there is something we should do first. Let the myocardium and microcirculation recover a bit, and there is animal data to support that, and then do the PCI. So we're trading a little bit of ischemic time for an increase in physiologic parameters that may help the myocardium. The short version of the outcome is straightforward. There's no difference in downside on this. The patient outcomes are not changed. None of the patients actually switched over to an emergency PCI that were in the delayed group. And the microcirculation now seems to have improved enough so that when the patient is reperfused with their PCI, the ventricle, the myocardium, is now ready to accept that burst of blood once again. So no downsides to the trial in terms of patient outcomes. In patients who have large myocardial infarction, the largest group, a subgroup analysis, of course, there seems to be an indication that those patients benefit the most in terms of myocardial infarction size reduction. So it's an exciting preliminary trial that will go forward now with a larger trial. Now it's been proven not to be adversely affected to patients with infarcts. And we'll see whether this concept of a left ventricular holiday, in fact, will allow patients to hopefully have a reduction in infarct size by unloading them first for 30 minutes and then reperfusing them.